If you've been watching the news, the United States has announced its intention to withdraw from the World Health Organization. Some may be wondering what this means for them, personally and professionally. To comment on this, I'm pleased to welcome Dr. Gavin Macgregor-Skinner, Senior Director at ISSA. Gavin, welcome to the program.
Thanks, Jeff, and it has been a busy week.
I think most of your weeks are very busy. And when something like this is announced, you probably get busier. Gavin, initial thoughts.
Yeah, I think the challenge we have, there's a gap there, Jeff, with the industry is what does the World Health Organization do globally? Well, they have 194 member states. That's really countries and other states that, 194, very representative. I've been on a number of deployments, Jeff. My personal experiences working with the World Health Organization. 2004, I had a 9-week deployment to Indonesia for the tsunami response. 2014, I did 3 deployments to West Africa for the Ebola outbreak, setting up, managing Ebola hospitals. I've had 3 deployments to Afghanistan, 2 deployments to Iraq for really strengthening, prevent, detect, and respond to infectious disease threats and looking at systems. And I can say that those deployments, the work that I did with WHO or World Health Organization, is about successful coordination and collaboration. And that's what's really a good point to everyone. Understand that the world does need an international infrastructure to fight infectious diseases.
So that makes sense. And thank you for all you've done through your career to help combat these infectious issues. Some might wonder, how is the traditional cleaning industry tied to this decision? Is this going to impact our frontline workers, those who are part of ISSA?
Yeah, good question, Jeff. Many of our ISSA member companies are international. The point that I'd really want to highlight to everyone in the industry that, yes, you may hear that the US government might, withdraw, and they've done it before. They've withdrawn from the World Health Organization. But more importantly, that's going to leave a gap. It's going to leave a massive vacuum when it comes to prevent, detect, and respond to infectious disease threats. And really want to emphasize that America cannot stop the pathogens from crossing its borders. Let's look at Ebola, Jeff. A person hopped on a plane, landed at an airport, went to a city, went to a hotel, went to their apartment, went to a hospital, and spread the disease. And we've seen that happen many times for other diseases. So really, I think right now we need to talk about what the cleaning industry could do and how they do it. And it probably doesn't take a lot of money to do what they need to do if we do withdraw from the World Health Organization.
So, Gavin, despite how you might feel about this withdrawing from the World Health Organization, you see this as a possible opportunity for the industry.
Yeah, whenever there's change, Jeff, it creates emotions. And
Mm.
we've seen a lot of emotions come out this week. But whenever there's change, then you have to bring the team together, the community, and come up with what happens next. And so, from the cleaning industry perspective, we need a coordinated effort. We need to, again, educate, train, make aware of what is our role in preventing and responding to infectious disease threats. How does the entire value chain of the cleaning industry, how do we build technical capacity? How do we strengthen supply chains for equipment, tools, and products? How do we, as a community, as a cleaning industry community, continue to establish technical norms, standards, and guidance? And so I'm going to throw out 3 things here, Jeff. Right now, this team needs to come together. That team consists of anyone that creates or delivers cleaning products. That's the first part of the team. Manufacturers, distributors, wholesalers, retailers. The second part of the team is anyone that cleans buildings, building service contractors, in-house service providers, residential cleaners. The third part of the team is anyone that operates buildings or facilities that need to be cleaned. The building owners, the facility managers, the operation managers, the supervisors. Because as we saw when we had Ebola, when we have flu, when we have norovirus, when we even had COVID, there were critical gaps on how do we clean. And if we could get that team together, those key parts of the industry together, come up with solutions, tell the world, this is what we do, this is how we do it. These are the the critical methods and procedures to clean and disinfect to decrease the likelihood of those infectious disease spreading because history's shown us. Person hops on a plane, lands at an airport, you've got the disease.
History tells us that, and a lot of movies too. So there's that.
Yes, Jeff, there's been a few good movies, and probably
Yeah.
now's the time to get back on your Netflix, Prime, whatever account it is, and watch a few of those movies.
To scare you straight, maybe.
Maybe.
So, Gavin, it sounds like as this develops and this withdrawing occurs, trade associations become even more important.
Yes, what the US government does, they'll make decisions, but what they do is going to leave critical gaps. And we as an industry, so ISSA, leading association for the cleaning industry, if this happens, we should be now preparing a plan and working out how to fill that critical gap. We've got the World Health Assembly. This is the World Health Organization. Big meeting occurs in May. The government's going to handle that. They'll do that. Parts of the non-government private sector do attend. But we've also got International Cleaning Week, March 23rd to 29th. We want everyone to come together to look at solutions, but more importantly, let's distinguish those critical methods and procedures, Jeff. Let's look at where we set the standard of care for the industry, and let's look at how we work as a team to continue to create healthy and safe built environments and also then prevent diseases spreading. We've got big norovirus, big flu outbreaks happening right now. And again, we're seeing our members respond appropriately.
And it's good to see that happening, the collaboration. Well, Gavin, we have a lot to do. Let's get going.
Sounds like a plan, Jeff.